My pain with age has certainly increased. Coming up now to 27 years post-injury. The last 5, 6, 7 years, it's definitely increased for sure. Two main types of pain for me these days. One would be in my T5. Bone is starting to break apart a bit and it's causing a lot of tightness throughout my back and then into my core. Leads to a lot of tone, a lot of spasms. And the other one I would describe it as a tingling sensation, a pulsating sensation in my feet, which tends to present itself mostly at night in bed as far as pressure on my heels, ankle bones, that kind of thing.
We see pain in up to 70% of people living with spinal cord injury, and that pain often has an impact on quality of life. It may disturb their sleep, it may disturb their activities of daily living, it may disturb their emotions or their mood, so it really has an impact on all aspects of life. Neuropathic pain is the pain that we see following spinal cord injury that we think is due to changes in the nervous system. It typically will be a tingling or burning type pain. It can either be felt at the level of the injury, so around where the injury changes from intact sensation to altered sensation, or it can be below the level of injury. Often we see a change in neuropathic pain, particularly an increase in pain as people age. It's always important for someone with neuropathic pain to let their physician and healthcare providers know if they're seeing an increase in pain. Musculoskeletal pain as people age is very common, whether people have a spinal cord injury or not. Pain that's felt in bones, in joints, in muscles. I see people having more shoulder pain, having more wrist pain, probably due to using their upper limbs so much. Sometimes we see wear and tear changes in the spine as well. Everyone is susceptible to osteoarthritis as they age. Osteoarthritis is what we call wear and tear arthritis.
The closest I've come to pain med would be melatonin, just to help me sleep or almost force me asleep to get through that pain. The pain once I am asleep tends to subside.
Sleeping poorly can be caused by pain, so it's important for people to get adequate sleep, to really be paying attention to their sleep hygiene. But it's also important to think about using medication at night if needed to help with pain. Whenever someone comes in with a change in pain, we start just by taking a history, finding out what that pain feels like, where they're feeling it, what things make it worse, what things make it better. Was there a change in habits? Was there something that happened to trigger that pain? Can we figure out what that source of pain is? A lot of what we do when we're treating pain is we're trying to dial it down. Some of the ways we can address that is through cognitive behavioral therapy, or CBT. It helps people think about their pain differently. Mindfulness, visualization, meditation, these are all things that we can try to use to help modify pain and the way we perceive pain. Oftentimes with musculoskeletal pain in particular, we are looking at activity modifications. So if it's shoulder pain, can we look at doing fewer transfers? Can we look at getting a lighter wheelchair that's easier to push? Can we look at getting a power assist for their wheelchair? Can we make things a little bit easier? The other thing we'll look at is, can we do some strengthening exercises? Oftentimes, the activities we're doing over time will tend to favor certain muscles and use certain muscles more than others, and those other muscles may not get them as much strength and range of motion as they should. To try to maintain that muscle balance, particularly around the shoulders, is really helpful.
As far as my back pain, the biggest thing for me is movement, exercise, stretching. As long as I can keep moving and I'm not in one position for too long, the actual movement is helping in some way as a relief. If I sit still for more than a few minutes, I seize up and that back will spasm. I've always been a big proponent of exercise and movement. Those days where I am active are by far a lot better than the days that I'm not.
We use very different medications for musculoskeletal pain versus neuropathic pain. Often for musculoskeletal pain, we're using things like non-steroidal anti-inflammatories, or NSAIDs, things that fall such as ibuprofen. We may use some Tylenol as well. Those traditional painkillers don't tend to work as well for neuropathic pain. And so we'll often use medications such as gabapentin or pregabalin, which act on the central nervous system and we think alter neurotransmitters a little bit. when we're using opiates or narcotics. There is always that risk of addiction, and so we do try to avoid them if possible. They don't necessarily work that well for neuropathic pain, and we don't want people to have to need more and more and more medication over time. Sometimes there's surgery that's required for musculoskeletal pain. It really depends on the pain source and whether or not surgery can be used to help it. We all have heard about people with osteoarthritis having joint replacements, having knee replacements, or having hip replacements after osteoarthritis, which can be a source of pain in the knees and hips.
I have met with my doctor about T5 bone starting to crumble and break apart, and we did address the possibility of surgery, but at this point I'm hesitant to go down that path, potential risks and just the recovery from it as well. The first thing I will tell people, seek out different paths, not just the doctors. Physio has helped me, even OT and my occupational therapist with different equipment. Some of those changes can really help with pain as well. I know things are going to get harder at some point, but I'm also confident I'll be able to work through it, minimize the pain day to day as it comes.